The heart of this conflict is a falling out between Sudan's army chief, General Abdel Fattah al-Burhan, and his deputy turned rival, Mohamed Dagalo, who leads the RSF. Since the conflict broke out nearly 2 years ago, tens of thousands of people have since been killed and over 12 million displaced. The biggest humanitarian crisis ever recorded, says the United Nations. Let's bring Christopher Lockyear. He's the MSF Secretary General. Thank you very much, Christopher, to join us. So 2 years on, what is the humanitarian situation today?
Yeah, well, I was in Sudan. I was on the Omdurman area of Khartoum just a few days ago. And as I was there was a shell hit a crowded market area. And the hotel that Médecins Sans Frontières, Doctors Without Borders, is supporting in Khartoum received dozens and dozens and dozens of critically injured casualties. I counted 60 people waiting on the floor and in beds in the hospital for urgent treatment, and I saw the morgue in the hospital that was overflowing with dead bodies. This is just one small, in the grand scheme of things, illustration of the catastrophic humanitarian crisis that we're seeing in Sudan. There's this horrendous violence against civilians. There is acute levels of malnutrition. Around 50% of the population are suffering from acute levels of food insecurity, and an epidemic of violence against women. So it really is an incredibly horrific humanitarian crisis that we're witnessing before our eyes.
And the United Nations just made an appeal asking for a $6 billion contribution to assist the population. So why such a staggering amount? What are the specific needs?
Well, there's no doubt that there needs to be a massive scale up of humanitarian assistance. The difference between the needs and the humanitarian response on the ground is huge. I mean, we're witnessing a global humanitarian failure in Sudan. And money is important in that equation, but it's a lot more than money that is needed. We need organizations, the international community and the UN to take politically brave steps to ensure that they're pushing against the restrictions and the complications of working in Sudan. We need to be protecting civilians. We need to be ensuring that the warring parties are permitting access for humanitarian organizations, and humanitarian organizations need to be ensuring that we are providing the assistance that is needed.
And you're representing Doctors Without Borders. So what kind of health issues do you have to deal with? You touch upon the situation of malnutrition.
Yeah, well, the health system has been critically affected through this horrendous war. I mean, in areas of conflict, the acute areas of conflict, there's up to 80% of the health facilities have been destroyed in an already underserved health system. And so we see a full range of needs. We ourselves have treated nearly 2,000 people for trauma-related surgeries. We have treated around 60,000 people for malnutrition-related needs. And so we are seeing across the spectrum a huge need for healthcare, and we are seeing healthcare installations, hospitals attacked and becoming part of the war. We had to suspend some of our activities in the Bashir hospital in Khartoum because of the violence within the hospital itself.
And a dire situation indeed, and we're still far from achieving a peace deal. Fighting, as I said earlier, continues between the paramilitary and the army forces. So do you communicate with any of those parties?
Yeah, wherever we work, Doctors Without Borders tries to communicate directly with the warring parties. We do that to talk about how we would like to work, to explain who we are, to try and negotiate access to the populations in the greatest need. And so we're in constant contact, or we try and be in constant contact with the warring parties for those reasons. And that can be a very complicated endeavor, because it also means that we're relying on them in terms of being able to pass messages through their troops, through their organization, to ensure our safety and to allow patients to access the health facilities that we're supporting.
And quickly, if you may, what do they say about the magnitude of the situation that they are responsible for?
Well, what I would say to this is that this is a war on people. This is a war on civilians. And this is one of the most tragic illustrations of this conflict as a whole. And I would implore everybody involved in this conflict to ensure that they are protecting the civilians, the most vulnerable people at the heart of this conflict, to ensure that we're reducing the impact on them and allowing them to receive the medical treatment that they so critically need.
Thank you very much, Christopher Lockyear from the MSF.